Hello, doctors. First of all, congratulations. You're done with your exams. I'm sure that would have been a very long and tiring journey. Now it's time for you have to have a good break. Now we just look at some of the recall questions from the recent NEET exam. Keep in mind that these are recall questions and not exact questions as such. And so, yeah, let's go into it. So the first question in anesthesia is a 2-year-old child has choked on a peanut. What is the most appropriate immediate management? Option A, chest compression. Option B is back blows. Option C is abdominal thrust. And option D is endotracheal intubation. So the first thing you need to do is crack the question. Okay. So the age of the child is 2 years. Keep that in mind. And the next thing you need to know is whether the child is conscious or unconscious. So if the child is unconscious, the treatment would be to start CPR immediately. Then the answer would be chest compressions. But in this question, there is no mention of the child becoming unconscious. So you assume the question to be a 2-year-old child who's conscious and who is starting to choke on a peanut. Any child that is less than 1 year of age, you usually give them back blows. And child who's more than 1 year of age, the ideal thing to do would be to give abdominal thrust to take out the choked peanut particle. So for as long as this question is concerned, you have a 2-year-old child who's conscious and who's choking on a peanut. So the right option here would be option C, abdominal thrust. Next question. Patient was administered sevoflurane and succinylcholine for abdominal surgery and develops muscle rigidity. What is the drug of choice here? So here the key questions are the clues that we have is sevoflurane, succinylcholine, and muscle rigidity. This seems to be a case of malignant hypothermia. So both sevoflurane and succinylcholine are known to be triggering factors for it. And when you look at the options, it's dantrolene, diazepam, propranolol, and paracetamol. Here, the right answer would be dantrolene. So for malignant hypothermia, the inciting factors will be sevoflurane and succinylcholine. Patient develops muscle rigidity, then increased end-tidal carbon dioxide. Hypothermia is a late sign. Patient can develop definitely tachycardia, acidosis, and patient can go in for hyperkalemia. And finally, because of the myoglobin breakdown, they can go in for renal failure, which can lead to multi-system failure. So the first thing to do would be to take off the inciting factor, that is, shut off the sevoflurane, disconnect the entire circuit, use a new circuit, and then start to treat the patient symptomatically. But the drug of choice here is dantrolene, 2.5 mg per kg IV, and can be repeated up to 10 mg per kg IV with supporting treatments such as cooling the body, and then you can even go in for dialysis to help with the renal failure, treat the hyperkalemia, etc., etc. So here the right answer would be dantrolene. Next question: which intravascular crystalid given in excess can cause hypochloremic metabolic acidosis? Option A, ringal lactate. Option B, normal saline. Option 3, dextrose, and option D being DNS. The answer here is very straightforward. It is normal saline. So our normal chloride level in the body is around 110 milliequivalents per liter. Normal saline usually has 154 milliequivalents per liter of sodium and chloride, and giving it in excess amounts will basically what it will do is the chloride will displace the bicarb, and the patient will go in for a non-anionic gap metabolic acidosis, which is the main reason is hypochloremia. So four things are important. So it's non-anionic gap, that is the anion gap is normal. Patient is in acidosis, so pH is less. Hyperchloremic, so chloride is more. And the patient will obviously have reduced bicarb. So the answer here is normal saline. Next question. A critically ill patient with COVID-19 is admitted to the ICU and is currently on mechanical ventilation. The PaO2 to FiO2 ratio is 100, indicating severe ARDS. Which of the following is the most appropriate ventilatory setting to manage this patient? Option A, high PEEP, low tidal volume. Option B, high PEEP, high tidal volume. Option C, low PEEP and low tidal volume. And option D, low PEEP and high tidal volume. So basically, what they are asking here is the Berlin's criteria. Okay, it's basically based on the PaO2 by FiO2 ratio. If it is between 200 to 300, it is mild ARDS. 100 to 200, it is moderate ARDS. And less than 100, it is severe ARDS. Whenever that happens, we adopt something called a lung protective ventilation. Basically, you need to protect the patient from volume trauma and barotrauma. And the basic principle is you need to give low tidal volume of about 4 to 6 ml per kg. So let's say the patient is about 50 kgs. You keep the tidal volume at around 6 ml per kg. That comes to around 300 ml. And then you titrate it slowly to about 4 ml per kg, which is around 240 ml. So the answer should be low tidal volume. So out of the options that is given, option A and option C are the ones which have the option low tidal volume. Now we need to determine whether we need to keep high peak or low peak. The answer here would be obviously high peak, because peak and expiratory pressure, what that basically does is it prevents the alveoli from collapsing during the expiration, meaning there's more room and time available for oxygen diffusion to take place. So when it comes to lung protective ventilation, we have certain things that we need to follow. Number one is high PEEP. Number two is low tidal volume. Number three is make sure that your peak plateau pressure is less than 30 centimeters of water. And number four is you don't need an oxygen saturation of 100%. Oxygen saturation anywhere between 88 to 94% is allowed, which is actually good for the patient, and some amount of permissive hypercapnia, that is increase in EtCO2. The normal value is 30 to 35. You can let it go up to 40 to 45, which is allowable. Uh, the other strategies that can be used to treat severe ARDS, a patient can be put on ECMO. You can give the muscle relaxant to aid in the synchrony between the patient and the machine, because if there's asynchrony between the patient and the ventilator machine, it can become an issue. And you can even prone the patient. Proning the patient has been shown to improve perfusion and diffusion of oxygen. So, as I told you, here the lung protective strategy is low tidal volume, high peak plateau pressure of less than 30 centimeter of water, and oxygen saturation maintaining between 88 to 94%. So, option A would be the right answer here. That is high PEEP and low tidal volume. Next question. A patient is undergoing surgery and is administered succinylcholine along with a muscle relaxant. Shortly after, the patient develops bradycardia and hypotension. Which of the following is the most appropriate life-saving drug in this scenario? Option A, dantrolene. Option B, propranolol. Option C, atropine. Option D, epinephrine. So this is one question that really caught my eye, because it's quite a tricky question. This is how they trick you in the exams. You have to decode it, look at the option, rule out the option, and then try to get the right answer. So now here's the trick. Okay, so they have mentioned two things. One is succinylcholine followed by a muscle relaxant, and shortly after, the patient develops bradycardia and hypotension. Okay, when we read the option A is definitely not the right option. Dantrolene has no use here. Option B, propranolol you will not give, because patients already bradycardia and hypotension, you will not give. So the option should be either C or D. It should be either atropine or epinephrine. Okay. Now this is where many people will make a mistake. Okay, you see bradycardia, you see hypotension, you see some muscle relaxant that has been given, you will think it is epinephrine. But here the trick is to keep in mind that drug that has been given is succinylcholine. Okay, succinylcholine is a culprit here, because it is known to cause bradycardia, especially in pediatric patients. Whenever you repeat a dose of uh, succinylcholine, it's mainly because of its parasympathetic effect, the muscarinic receptors, M2 receptors that are present in the heart. So, succinylcholine is the culprit here, which is causing bradycardia and hypotension, and the drug of choice here is atropine, okay, to treat this bradycardia and hypotension. Now, let's say, along with this, they are given one more option, okay, succinylcholine along with a muscle relaxant, and the patient has developed bradycardia, hypotension, and flushing of face, okay. Then our answer would vary, because whenever you have this flushing of face, it means there is some amount of histamine release. In that case, the other muscle relaxant, that is most probably atracurium, would be the culprit. In that case, your drug of choice would vary. Yeah. So this is how they tend to confuse you. I'm telling you this because the next question is almost similar to this, and it's quite confusing. So here, as far as this question is concerned, the culprit is succinylcholine, which is causing bradycardia and hypotension. The drug of choice here is atropine. Coming to the last question, a patient is scheduled for surgery, develops it's actually perioperative, I think, bradycardia, hypotension, and facial flushing. See, this is the thing. Which of the muscle relaxant is most likely responsible for these symptoms? A. Atracurium, B. Cisatracurium, C is pancuronium, and D is mecuronium. Here, bradycardia, hypotension, the same as succinylcholine, but facial flushing. Okay, so facial flushing is something that is associated with histamine release, and the culprit here that is most likely to cause histamine release and the above said bradycardia and hypotension, etc., is atracurium. Cisatracurium is an isomer of atracurium, which has been used because it has less side effects compared to that of atracurium. Pancuronium and vicurium usually do not cause facial flushing and histamine release. So here the right answer would be atracurium. So from these recall questions, the main thing that you need to understand is not about how to, not about picking the right answer, but about how to go about solving an MCQ. Okay, so first read the question, crack the question. You see how they are confusing you, right, with the questions and the options. Then look at the options and then rule out and then tick the right option. For example, in this question, when I see the option A, B, C, D, atracurium, cisatracurium, pancuronium, and vecuronium, I know that the answer cannot be pancuronium or ocuronium. So I have ruled out two options. Now I am left with only two options, atracurium or cisatracurium. So my probability of getting the answer right is 50%. And if you've obviously read for the exam, you will definitely know that cisatracurium is not likely to cause histamine release. That's one of its advantages why we use it. So the culprit here is atracurium. So remember, always read the question, crack the question, rule out the options, and then pick the right options. So these are the recall questions from anesthesia for your recent NEET exam. So just have a go with them, and then no matter what options answers you've given, don't think about them too much. Relax for now. Once the results comes, we'll meet again. Okay. All the best. Thank you.